right, perfect. Well, it is my great pleasure to report on the development of the CCFA Partners Kids and Teens internet-based inflammatory bowel diseases cohort. I have no relevant disclosures. As many of you in this audience know, prospective cohorts of pediatric IBD are needed to study disease natural history, identify prognostic factors and environmental factors that relate to disease relapse risk, and to evaluate both the safety and effectiveness of IBD treatments. Most pediatric IBD cohorts in the US rely on center-based recruitment and data collection, and therefore involve patients followed at large or academically oriented practices, are very time and resource intensive, and focus on physician-reported data and biosample collection. In contrast, CCFA Partners is an internet-based rather than center-based cohort of adult patients with inflammatory bowel disease, and over a 2-year period has enrolled a large and diverse study population of over 12,000 adult patients from all 50 states and 4 US territories, treated in both academic and private practice settings. The use of web-based recruitment and data collection is both efficient as well as cost-effective, and there is a large focus on patient-reported exposures, health behaviors, and disease outcomes. The objective of our work was to develop an internet-based cohort of pediatric IBD patients in close collaboration with the Crohn's and Colitis Foundation of America. We recruited children less than age 18 with self-reported inflammatory bowel disease through email invitations to the CCFA constituent groups, promotion on the CCFA website and social media, as well as chapter events. And after informed consent and assent were obtained, parents and their children completed a baseline web-based survey containing questions regarding disease demographics, disease characteristics, disease activity, treatments, adherence, and quality of life, including both the Impact 35 and other patient-reported outcome measures. All surveys were designed to be developmentally appropriate with increasing levels of self-report based upon patient age. We used validated survey instruments when available. At 3-month intervals, an email update on the study progress as well as educational materials developed by the CCFA were emailed to all participants and their parents. We have follow-up surveys planned on an every 6-month basis, and enrollment and linkage to the adult CCFA Partners study is planned upon a child's 18th birthday. Here's what our website looks like and is a place for further information for both current and prospective participants as well as the scientific community. And each of the tabs will show you different information. Participants or physicians can log on to the partnership stats tab and see up-to-the-minute statistics regarding enrollment demographics and characteristics. And we have a very strong interest in sharing the results that we learned through this study with the patients and their families who have provided us this rich and valuable source of data. We post up-to-the-minute abstracts and manuscripts, not only the scientific contents, but also lay summaries. And this is an example of the 3-month email that went out this fall. At the top is some information about the cohort and recruitment progress to date, and at the bottom was a message developed by the CCFA about the importance of influenza immunization. And so the preliminary findings, at least based on the first 4 months of our cohort, are as follows. We've thus far enrolled 570 participants from 47 US states and 6 countries. About 55% of cohort participants are male, 45% female. 422 or 74% report Crohn's disease, 134 or 24% ulcerative colitis, with the rest indeterminate colitis. The median age at enrollment was 13 years, and the median age at diagnosis was 9 years, with the distribution broken down in greater detail below. How are these patients being treated? About 27% of Crohn's disease patients and 38% of ulcerative colitis patients report current 5-ASA use. 9% of Crohn's and 15% of UC patients report current prednisone use. For immunomodulator use, as shown, 43% for Crohn's disease and 34% for ulcerative colitis. And biologics, 51% for Crohn's disease, and 18% for ulcerative colitis. When looking at ever use, 58% of Crohn's and 76% of UC patients were ever users of 5-aminosalicylates. About 80 to 85% were ever users of prednisone. Immunomodulator use was slightly higher in the Crohn's group compared to the UC group at 68 and 55%. And biologic use was 57% in Crohn's and 38% in ulcerative colitis. When looking at surgery, about 16 to 17% of both groups had underwent one or more resections prior to study enrollment. As mentioned, we place a strong emphasis on patient-reported outcomes and have concentrated on the NIH PROMIS, or Patient-Reported Outcome Measurement Information System, set of domains. We have initially selected 5 domains: depressive symptoms, anxiety, peer relationships, fatigue, and pain interfering with daily activities as the PROs for greatest concentration. These are graphs looking at each of these 5 domains as a function of increasing quartiles in the impact questionnaire. With the impact survey, a greater score indicates improved quality of life, and as you can see, as impact scores increase, patients report less depression, less anxiety, less fatigue, less pain interference, and greater peer relationships. Similarly, this graph shows mean PROMIS scores across groups of patient global assessment, and as points move to the right, patients are reporting greater symptoms, and again, with greater symptoms, with greater GI symptoms, patient reports more depression, more anxiety, more fatigue, more pain interference, and worsening peer relationships. So in conclusion, CCFA Partners Kids and Teens is a novel internet-based cohort of pediatric inflammatory bowel disease that is really a unique partnership between the Crohn's and Colitis Foundation of America, the patient community, and the research community. It is a channel for all children with IBD to participate in research, regardless of where they seek their care. And these primary findings, or preliminary findings, suggest that internet-based recruitment and data collection are feasible in the pediatric population. And of course, growth in enrollment and long-term cohort retention will be critical to the success of this project. Some of the important implications of this work are as follows. First, I think the focus on patient-reported outcomes will be increasingly important in observational research and a critical complement to some of the clinical endpoints and endoscopic endpoints of mucosal healing, which are quickly becoming the way the pendulum is swinging, as we heard about earlier in today's session. We also have an opportunity for dual enrollment and linkage with some of the clinical cohorts that exist. And this will allow analyses that combine both clinician-reported data, patient-reported data, and biosamples. And finally, I think this may be a really special opportunity to study and evaluate some of the long-term outcomes of pediatric inflammatory bowel disease. And by long-term, I mean outcomes that occur over decades, because this will present a way to follow up patients far after the transition from pediatric care. And I'd like to conclude with the fact that this is meant to be a platform for ancillary studies, which might consist of secondary data analyses, supplemental surveys, simple or pragmatic clinical trials, and even studies which involve biosample collection. And I'd like to please request that all of you get involved. Please submit ancillary studies. If you go to our homepage and go to the For Researchers tab, we have a very open and transparent ancillary studies process, and it would be great for as many of you in this room as possible to get involved. And you can also download our patient brochure and promote this exciting project to your patients. Thank you very much. I'm happy to answer any questions.